Hello everyone, my name is Brian Wilkening and in my presentation today will describe the differences between visceral fat and subcutaneous fat. I'm sure we all know that having a large belly is unhealthy, but are you aware that not all belly fat is bad? There's a portion of belly fat in the middle that lies directly under your skin. This fat is called subcutaneous fat and is not necessarily unhealthy. Visceral fat, on the other hand, is unhealthy because it's unseen and can be wrapped around your organs. It is possible to have visceral fat but not be obese. A study done in 2004 showed that patients who instantly lost 30 pounds of subcutaneous fat through liposuction surgery had no health improvements if they had a lot of visceral abdominal fat that remained. Visceral fat around abdominal organs cannot be liposuctioned out. You cannot grasp visceral fat with your hands. It is out of reach and inside your body. It lies deeply inside your abdomen, filling the spaces between your organs. Visceral fat wraps around organs such as your liver and spleen. This kind of fat can interrupt the regular function of your organs and produce harmful substances. Though visceral fat is especially predominant in people in their mid-30s and older, people of any age can suffer from its negative effects. Visceral fat is sometimes referred to as active fat because research has shown that this type of fat plays a distinctive and potentially dangerous role affecting how our hormones function. Visceral fat makes up 6 to 20% of total body fat. It has a greater number of small cells with richer blood supply. It is intra-abdominal with direct drainage to portal veins. It has a greater catecholamine-induced liposis and causes reduced insulin inhibition of liposis. Subcutaneous fat is the kind you can grasp with your hands on any part of your body, including around your middle. While visceral fat is the more dangerous of the two types, subcutaneous fat isn't benign. The added weight caused by overeating and lack of physical activity can stress your joints and increase your risk of heart disease. Subcutaneous fat is found directly under the skin. It is the fat that's measured by using skin fold calipers to estimate your total body fat. Fat accumulated in the lower body, a pear shape, is subcutaneous fat, while fat in the abdominal area, an apple shape, is largely visceral. Where fat ends up is influenced by several factors, including hereditary and hormones. As the evidence against abdominal fat mounts, researchers and clinicians are trying to measure it, calibrate it with health risks, and monitor changes that occur with age and overall weight gain and loss. In terms of overall health, subcutaneous fat in the thighs and buttocks, for instance, may not be as bad as may have been potential benefits. It may not cause as many problems as other types of fat, specifically the deeper visceral fat, but subcutaneous fat on the belly may be another story. There's emerging evidence that the danger of big bellies lies not only in the deep visceral fat, but also in subcutaneous fat. Subcutaneous fat makes up around 80% of total body fat. It has a small number of large cells with poorer blood supply. It is extra-abdominal. It has a reduced catecholamine liposis and increases insulin inhibition of liposis. Carrying a high amount of visceral fat is known to be associated with insulin resistance, which can lead to glucose intolerance and type 2 diabetes. Researchers have found that visceral secretes a protein called retinol binding protein 4, or RBP4, which has been shown to increase resistance to insulin. Visceral fat is associated with heart disease, metabolic disturbances, and sleep apnea. All of us will have a certain amount of visceral fat, but those of us with a large quantity of visceral fat may be exposed to increased risks of the following health conditions: cancer, type 2 diabetes, dementia, lipid problems, non-alcoholic fatty liver disease, hypertension, heart disease, and polycystic ovarian syndrome. The most certain way to tell if you are storing excess visceral fat is to undergo an MRI scan. However, MRI scans are not a cheap procedure and is therefore not recommended as a diagnostic tool. A relatively good indicator of visceral fat is to take a waistline measurement. Harvard University notes around 10% of our total fat is likely to be stored as visceral fat. Therefore, if you are carrying higher amounts of body fat than is recommended, it is therefore more likely that you are storing more visceral fat than is healthy. Research has shown that the size of our belly is a relatively reliable indicator of our health risks linked to visceral fat. People can often reduce deposits of visceral fat by a combination of aerobic exercise and changes in diet. Research recommends a minimum of 30 minutes of aerobic activity like brisk walking or jogging at least 4 times a week. Stomach exercises like sit-up build muscle in the area, but will not reduce this kind of fat. Additionally, resistance training, like using exercise machines, can help with subcutaneous fat, but not abdominal fat. Doing any type of aerobic exercise can have a significant impact on visceral fat, which may last for up to a year after any weight loss occurs. In terms of diet, a meal plan that's heavy in fruits and vegetables, high fiber foods like whole grains, and lean meats can help with losing visceral fat. It's also best to avoid sugary drinks and products that are heavy in saturated fat, like butter and fatty cheeses, and use natural cooking oils that are higher in monounsaturated fat and polyunsaturated fat. Appropriate portion size is also important. Lifestyle changes can also help. As smoking and excessive drinking can lead to increased visceral fat, it's best to moderate or break these habits. Also, getting enough sleep is very important for losing weight. Some studies show that meditating or praying can help with this type of weight loss, as they can lower a person's stress level. Thank you for your time today, and I hope you've learned more about visceral fat versus subcutaneous fat.